topic, digitalization in the healthcare, the way forward. World is getting digitalized and so is our healthcare system. Let's get the insight on this by our own Dr. Shivkumar Utture. Sir is President of Maharashtra Medical Council, member of National Medical Commission. He is Professor of Surgery at GMC Mumbai and honorary surgeon at Fortis and Shivkumar Hospital. Over to you.
Hello. Yeah. Thank you very much for having invited me to give a call to give this talk today. So basically, when Dr. Sonanis gave me a call and we discussed what we should be talking about, and because this is an AMS conference, and we are talking about liaising. Of course, liaising means between different consulting groups. But then I felt that we should talk something about what should be done for as far as what is going to come in the future, as far as the medical education and medical profession is concerned. And as you know, today we talk about all over India in different fields. We talk about digitalization, and digitalization. So today I'll try my best to take you in a different world from what we are, we are used to as far as medicine is concerned, and what is going to be the future of medicine and the future of medical practice. So basically what we call as digital health care. That doesn't mean only digitalization of being online, but complete ambit of what are the new technological innovations which are going to come in the medical field in the future. So the technologies and the applications that exploit digital, mobile and cloud platforms for treating and supporting patients, that is how we define digital healthcare of the future. And basically what it is going to do, it is going to be more proactive and efficient healthcare delivery system which is going to be there and going to help both the professionals and the patients also in the future. So the two keys for unlocking this productivity, because this is something new, and whenever there is anything new, of course you require to open up these doors for the medical profession, and these two new keys are the improvements which are taking place in technology in a very fast-paced way, and reimagining the work itself, how you will practice in the future, how will you learn medicine in the future. So these two aspects are going to be the most important things. We have seen technological advances, that means my generation is seeing that, but basically this talk is going to be for the newer generations, especially we have a lot of JDN members and MSN members also, and they are going to be affected the most with this digital technological innovations which are going to come in the medical field in the future. So basic talk is going to be for the next decade, that is 10 years hence, what is going to happen to the medical world. And all this is going to basically be based on the big data which is being collected all over the world. As you know, even in India, the Honorable Prime Minister has already launched what is known as the NDHM. And this is basically nothing but the data of the patients of all over India which is being collected, collated, and is going to be used in the future. And this is going to cause huge disruptions both in wellness and chronic, especially in chronic diseases, and of course sick care system which is going to come in the future. As usual, there is going to be a little bit reluctance, especially from senior members like us, because we are not used to this digitalization, but it is high time we also learn how to make use of these newer technologies so that you can give better patient care for the future. So digital culture, it is the time for the change which has come now, and that is now, I'm saying, is right from today itself. We have to change the way we look at our practice and the way we are going to practice in the future. This is especially in the last 2 years during the COVID era, it has taught us where we have made use of digitalization, where even I think the National Medical Commission has allowed you to do online practice also, which was not officially and legally allowed before. So all this is happening because the world is changing and we are supposed to also change along with this world. So what are the digital transformations in healthcare that are going to come? Basically, it is going to come because the patients are going to demand it. More than the doctors, it is the patients who are going to find a lot of positivity in this digital care which is coming in the future. And there are going to be medical wearable devices. I'll come to the details afterward. Devices which is going to help us to monitor our patients. And not only we monitoring, but the patient themselves can monitor their own health and their own wellness. Then the big data, as I said, the collection of data is taking place not only in India but all over the world. And this data is going to help us in the future to definitely treat our patients in a better way. Virtual reality is going to be there, and the training of the next future generation of medical students and consultants is going to be on this virtual platform, which is going to be there. And then, of course, artificial intelligence. Everybody talks about artificial intelligence. And artificial intelligence is going to come in a big, big way in the future. And I'll come to those slides in the subsequent slides. So there is a rise of on-demand healthcare by the patients only. And today patients want this healthcare at their own convenience, in their own time, and whenever they want to make it happen. Not as far, up till now I used to have that my consulting hours are between 6 p.m. and 8 p.m. and the patient used to walk into my consulting and we used to examine. But the time is going to come when the patients are going to be demanding that it should be at their convenience. And if we are going to do that in the future, it is high time you learn what is digitalization in healthcare system. So what the patients basically want is that their health should be in the palm of the hand. See, today what has happened? Your smartphones have come. Where have your cameras gone? Where is your watch which used to be where? I still remember when we were students and when we used to pass SSC, the first present given by a parent was a watch. That's how we used to, the watch was so important at that time. But today you see none of us are wearing the watch. None of us is having a camera. None of us is having a video camera. Everything is in that small smartphone camera which is there. And so is the case in future healthcare also. So the consumers basically want to be able to access all aspects of their health record and do so from the palm of their hand. So it is not no more going to remain in the hands of the medical person or the consultant, but it is going to be in the hands of the patient itself because of the advent and innovations in the smartphone. So positive impact of this technology is going to be in the healthcare. Telemedicine, all of us are used to it. If 2 years back I had spoken about telemedicine, there would have been a blank face everybody because we did not know what is telemedicine. But today, majority of us are already practicing telemedicine. Artificial intelligence, enabled medical devices which are going to come in the future, and blockchain electronic healthcare records, that is the data of every patient, single patient which is going to be there. Let me tell you, NDHM is doing it in a big, big way. Even the councils are giving all the details, not only about the patients, but the details of the practicing doctors also. So that whole data is collated by at the national front, and that is going to help you because today, even if you get a patient, say from Chennai or from Karnataka, and even if he is not carrying any of these papers, his whole health history will be there on that NDHM platform. So at a click of the button, wherever he has taken treatment, whatever his tests have been done, everything is going to be recorded over there. So it is going to be a win-win situation both for the parents, for the patients and for the doctors also in the future. So the growth of wearable medical devices is going to be. We have seen this growth happening, especially during this COVID time. We are seeing it. So what we see today, already we are using is the heart rate sensors which we are using, the exercise trackers, that pedometer and everything which we just on our smartphone we just downloaded. So that is nothing but digital transformation which has taken place. So at one time I still remember, whenever we used to even train athletics, our trainers used to hold that stop clock and then measure start to finish. No more. That everything is done by just that small device which sits into your pocket. Then sweat meters are another thing that is coming up in a very, very big way, which is tracks the diabetics, the monitors the healthcare continuously 24 hours. monitoring of the health of the diabetic status of that patient is being done. So just like how we have the Holter for cardiac, this monitors the blood sugar levels for full 24 hours. And then oximeters, all of us are, how many of us really knew what was an oximeter? It was, we had that huge box which was there in the operation theater used by the anesthetist at one time. But today, if you see that oximeter has become such a small piece which only fits on your finger, and you get so much of details of that patient which you can treat. I'm not talking only of the COVID patients, but oximeter is now being used for any and every respiratory problem, right from pediatric age to the elderly. So this is what I call that these are going to be the innovations which are going to come, which is going to be used by these 5 fingers that we have over here. So here you see, you have the oximeter, you have the blood sugar levels which will be calculated by just that small device over there. Your cardiac status, your ECG will be coming out from there, and then ophthalmic details also. All these are going to come in that small piece of phone that is going to be there in your pocket. So treating with digital technology of the future, what is going to be? It is going to be virtual reality, AI and machine learning, robotics. We have seen robotics. I'm a surgeon. We are doing robotic surgery now, laparoscopy. 10 years back, if someone had told me that I would be sitting, say, about 10 feet away, I would not have believed that I could have operated on a patient. But today I can sit 100 miles away, and that is going to be the next thing that is going to come in robotics. And that patient is going to be in some remote place with just the robo which is over there, and from there he would be able to operate on that patient. This is going to be the future. Then computer and machine vision, where you do not require actually to put your X-ray on the X-ray box to see anything. Everything is going to be computerized. Then wearable technology, which I already spoke. Genomics is another huge. It has come in the Western world, and today we are seeing it because in COVID times they are doing genome trial, tracking of all the mutations which are taking place. That is going to happen in the human beings also, and you will be able to predict tomorrow if that particular human being is going to have malignancy, he's going to have cardiac condition, or he's going to have any cerebrovascular condition. All this will be tracked in advance so that you can prevent it from happening, then going and treating, which is much more costlier and much more difficult for this patient. Then 3D printing, we have heard about 3D printing in other fields. It is going to happen. I'll come to that also in the next slide, how it is going to do in the health sector. Then of course 5G is another huge thing which is coming, which is going to completely transform the medical field in the future. When the 5G is launched in India, I think by November, December, it will be launched in India. So AI and machine learning, basically artificial intelligence. The repetitive work which is there will be taken over by these artificial intelligence and the robotics which are going to be there in the future. We have seen already existence of the Da Vinci, as I said, when we are doing robotic laparoscopic surgery now. But then the next huge thing is going to be the microbot which is going to come, and that will be giving a targeted therapy of specific part of the body, such as if you want to have radiation to a particular area of the body, or you want to send some medicines to a particular area of the body. Like today when we are doing chemotherapy, we give an injection, but that even affects every part of the body. That is not going to be the future. These microbots are going to take care of that. Then, as I've already said, the computer and machine vision, where the diagnostics, viewing scans, medical images, surgery. Today, whenever I refer a patient for CT scan, my radiologist is never there in that scan room. The technician takes all the films, beams it to him, and he gives his report and beams it onto my mobile. So it is going to happen for the future. This is coming in a big way. So they can give us all the details. Wearable techs I've already talked about as far as smartwatches, smartphones, everything is concerned. Genomics is a huge topic, and I think that will be a real, the future of what is going to happen even in India as it is happening in the Western countries. Now that is a big topic unto itself. I will not touch that. Then 3D printing, customization, research, manufacturing of healthcare. Today if there is a fracture, if you want to give a cast, you are actually sitting and doing the cast. Tomorrow what will happen? Suppose the patient is somewhere, he can beam his hand to you. The measurement is taken by the machine and the cast is 3D printed. and you put that cast to that patient. And this cast is not going to be a plaster of Paris. This cast is going to be of a material which can never be broken, never be twisted, nothing can be done. So this is a future which is already coming, and it is coming in a big, big way. Then of course, extended reality where the training programs even for our medical students. See, always there is, the hue and cry that the teachers are not enough. So today what is going to happen, and National Medical Commission has already taken the decision that it will be a central place where the professor will be giving his lectures, and all the medical colleges, it will be beamed directly. So you do not require an anatomy professor in every medical college. He will be there at the center, and in that same thing. So what it's going to do is the best of teachers will be able to give their experiences and their knowledge to all students everywhere in India, every corner of India also. So that is going to be the biggest advantage. Then of course, digital twins, where the lifelong data of as a person, as I said, NDHM is coming, your lifelong data from your birth to your death will be, everything will be digitalized, and it will be available just at the fingertip, just on the machine that will be available. 5G, transmission of large imaging files. Today, if you see, if you want to send some video files via WhatsApp or this, even your emails, when you want to send it, what you get that the file is too large, it cannot be sent. All that is going to go up. So you can actually have a live video recording which is transmitted somewhere because of the technology of 5G. It's going to be a beautiful technology which is going to come up in the future. Digital pharmacy. You sit, your patients come to you, you sit, you write a prescription. He takes the prescription, goes to the pharmacy to buy the medicines. What is going to be the future? Especially if he is coming online to you, your prescription will be also online. Just like it is happening in the Western countries, it will not go to the patient, that prescription will directly go to the pharmacist. And that pharmacist will send the medicines directly to the patient's house. So this is going to be the convenience for the patients also. Their time, their efforts are also going to reduce. And all this is coming because of digitalization. So just to give you whatever I have said, there is a short videos are there. Now, teaching method, I told you how teaching method takes place. So this is going to be an actually lifelike doll, which is going to be there. This is just an example I've taken of pediatrics, because that is one of the most difficult things is pediatric patients to examine. So how do you examine that? So this is what is going to happen, where the students are going to be taught how to take the eye movements beautifully. It will, and this whole thing is like a robot. That robot is going to do exactly what otherwise a human being would do. So if you see over here, the pupil and reaction, if you want to teach your students, you don't require to, 10 people don't require to come onto a live person, nystagmus, everything will be taught, and this robot is available to you for 24 hours. Not only when the patient walks into the clinic, but any student can come at any time. Your intubation you want to teach them, it can be done over there. You want to teach them, cardiac massage, it can be taught over here without breaking any ribs. Not only that, even surgically, if you want to put a tube, you can actually put this tube. So doing it on a live patient is very sometimes difficult. Not only difficult, you don't want to take any risk. So you can do it, which actually shows the blood flowing. Once you put the tube, even the blood flowing into the tube. So it is lifelike which is going to come, and this is the technological innovations that are going to be there. Then pulmonologists, how beautiful it is. See, this is like a science fiction world I am taking you into, which we always thought was magic. But this is going to be without actually doing on the patient, because you don't want all trainees to do it on the patient. This is an actual robot which is working over there for you and helping you to do that, where you can go down, see what is there, you can see the lesions which are lifelike lesions, you can actually catch the lesions and come out, you can take a biopsy, you can burn it with a laser, everything you can learn. See, in medicine, everybody knows that the more you practice, the better you become as a doing any procedure. So you cannot do that on a live patient. So you do that, even foreign bodies can be removed this way, and this is actually life. And even the complications that you cause are lifelike complications which are there. And all this is going to come as far as the future of teaching of medical students is concerned. This is already there. We used to do an endoscopy, gastroscopy, but we used to go only up to the duodenum at the most up till the, seeing the openings. Today, if you take a pill, that pill traverses right from your mouth, right up till which it comes out, when you pass it through your rectum, and on the way, it takes the photograph of your whole GI system. So every bit of your GI system is taken and it is computerized, beamed onto an external where you just sit on the monitor and you see your whole GI tract is seen over there. So if you want to see even these lesions, while it goes on taking photographs, you can see it flickering over there, the light, it is taking the photographs of that lesion. So you come to know. So, when you do you do a colonoscopy, you see one lesion. You may not see the skip lesions which are there, but that cannot be missed as far as this capsule is concerned. And these are also, as far as Indian context is concerned, reusable capsules. You can recover these capsules, get it sterilized, and use it for your next patient. So these are going to the things that are coming in the future. So microbot, nanobots, which I spoke about just now. What are these? Basically, they will take care of your health in an unprecedented precision way, which is not seen up till now. So what do these do? So these are the microbots which are loaded with the medicines or whatever it is. So that is a lesion, the cancerous lesion which is over there. You can see it is beamed only to that lesion. So all the complications that we see whenever you're doing chemotherapy, where your normal cells are also destroyed, are not seen because this is targeted lesion only to your cancerous cell. So this way, all medications can also be sent. It goes and gets attached over there. And once it gets attached, you can see the medicine flows through only to that particular lesion. So this is going to be helping you in a huge way, especially in your cancer treatment. So maybe a time may come where you may not require any surgical excision also, because this will take care of even those small lesions which are there and destroy those small lesions. So this is basically what is going to be having futuristic. So what else is there? Teleport to a virtual environment and perform robotic surgery, which I just now told you. I can be sitting 100 miles away on a console and doing a robotic surgery in a remote Gadchiroli or some area like that, and you have got the best person doing the best surgery in the poorest of areas. This is going to be teleportation, which is going to come. Augmented reality glasses, which are going to be there. See, nowadays you must have heard that if you want to go for a foreign trip, you don't require to spend the money. You wear these glasses and it virtually takes you for a foreign trip to see Singapore, to see Dubai, to see Canada, whatever it is. Same way, the students can be taught with these glasses, their medicine, and this is the reality glasses which are going to be there. Then virtual reality headsets to practice as far as the students is concerned, and 5G enabled drones. Now we are hearing it slowly, where drones are delivering the medicines. Now, recently you saw on the television that the vaccinations were by a drone. They sent it to a remote island, and they reached over there for the patients to get, for the population to get vaccinated as far as COVID is concerned. So this is going to happen in the future also. So this depicts exactly what is going to be the future. You are going to see the patient on a virtual platform. You are going to see what investigations you require, get that investigations done, feed it into the artificial intelligence to find out exactly what is the problem with the patient. Then it goes, monitors your heart and everything it monitors. What investigations, if you want, laboratory can also be done. Patient doesn't have to actually go to the laboratory over there. And once you have diagnosed what it is, the drones will carry the medicines actually to where the patient is. So the patient is going to be in a remote place, you are going to be in a centralized place, but you are going to be connected with your patients. This is the beauty of the future of this technology which is going to come. What do you see in a hospital today? The hustle bustle of the hospital, where you see those white coats running, in all these movies you see, or even you actually when you're visiting the hospital. Tomorrow, the wards are going to look like how you are seeing on one side, absolutely empty. And the residents who are supposed to be in the wards, whom we expect, we say, you residents, if you want to learn medicine, you're supposed to be sitting 24 hours in the wards. No, tomorrow he'll be sitting on the console in one air-conditioned room, monitoring all his patients, giving the treatments, getting the investigations done. So, this is the disruption I'm talking about. The whole concept of how you learn medicine, how you treat your patients is going to change in the next 1 decade. So human machines, what will it versus machines, that is going to be happen. And everybody asks me, this is going to happen, what is going to happen to us human beings who are practicing medicine? So we are supposed to change also. Machines are going to take over all the repetitive, tedious, heavy tasks which were there. Like how in the COVID time you saw the robots when it was not safe to go to the patients. The robots were carrying the medicines to the patients because you didn't have to put a PP and stay in the 8 hours in the PP. Tomorrow, if you have such robots, they can do all your tedious work, everyday work they can do. So what about humans? Should we all become programmers? Should we leave our clinical practice and become just programmers sitting and on a console and doing it? No, that is not what is going to happen. But at the same time, as more and more healthcare field becomes automated, healthcare workers must work to acquire technological skills that were not needed in the past. That means it is high time in a medical curriculum, you also incorporate technological changes or engineering also, at least basic of engineering, because that is what you are going to use as far as your future is concerned. And it should not be like how he's asking the computer, what can you not do anything right, and the computer says why you can't do anything right. So you have to get used to all these things. Now, having said that, what is going to be the problem as far as, so that beauty which all of us are used to of practicing clinical medicine, where we meet the patients, we examine the patients, that fun may go away from your medical practice. So if you see in this picture, every one of them, they are watching a parade, but everybody is busy capturing it on their camera. But it is this only old lady who does not have a modern technology, who's really standing and enjoying the parade. So maybe it should not come to that stage where you lose that enjoyment of your practice just because there is technological innovation. So this smile that you see, which we are doing today, which you are actually when you are examining the patient and interacting direct with the patient, that may tomorrow change. And same doctor, if you see over here, saying hi to that patient on a computer, which we are doing as far as today also, which we are doing when we do telemedicine. So that enjoyment, as I said, is going to go out. So at the heart of medicine is human connection, compassionate care, and empathic interaction with individuals who are vulnerable and ill. So that human connection may go off. That is what I believe may go off as far as whenever this new digital technology is concerned. So before I end, I think I have kept up to the time. Before I end, though this is a huge subject, I would just like to remind you that technology is a great servant when you use it properly, but it is an extremely terrible master if you do not know how to control your technology. So just like how we in the science fiction films we see those robots, where that Arnold Schwarzenegger's movies, where they take over the world, the computers and this. It should not happen that they take over your world. You should use them as your servants and not let technology become your masters in the future. So thank you very much for having heard whatever it is a new subject which I have come up with. Thank you very much, and I hope that this helps especially the newer generation of students and doctors who are going to be practicing in the future during these changes in the digital healthcare. Thank you.